Well, health officials in at least 2 states are tracking outbreaks of tuberculosis.
As Garrett Tenney explains, it's leading to tough questions about the state of public health in America.
Another possible public health threat is emerging from migrant shelters in Chicago. Health officials here say they're tracking tuberculosis cases among recently arrived migrants. It's not clear exactly how many infections have been reported. The city health department says it's a, quote, small number impacting a few migrant facilities. And we also don't know exactly what type of TB it is, though it's thought to be latent, meaning it's not transmissible but will still result in a positive test.
We call this latent infection, where their immune system is able to keep that tuberculosis dormant or quiet for undefined period of time.
And this isn't the only state dealing with a possible outbreak. The Southern Nevada Health District is investigating an active TB case at an elementary school. Officials say they've notified close contacts that they could have been exposed, but at the moment they're stressing the infection appears to be contained.
But that latent tuberculosis can then reactivate to become active tuberculosis at some point in the future. But for folks with latent tuberculosis, they cannot transmit tuberculosis from person to person.
It comes as the CDC is reporting a major uptick in measles as well, with cases in Chicago driven largely by outbreaks in those migrant shelters. 17 states now have confirmed cases, prompting new warnings from doctors and health officials.
It's definitely something to worry about, to think about, and to be aware that we are getting more measles than we used to.
The CDC says the number of TB cases in 2023 were the highest in over a decade. In Chicago, I'm Garrett Tenney, WDRB News.